Very, very briefly, we know that many things can activate the RAAS system, including the heart failure state. Anything that lowers blood pressure activates the sympathetic nervous system, alters sodium flux, will activate the release of renin, which causes angiotensin 1 to be formed. Of course, ACE causes angiotensin 2 to be formed, and then aldosterone to be secreted from the adrenal gland. Aldosterone is a great thing in health, and it does good things for us, but when it's chronically activated, it does some bad things. And these include causing pathological remodeling of the myocardium, the vessels. It causes sodium and fluid retention and potassium wasting, and it causes baroreceptor dysfunction. Angiotensin 2, which we're not going to talk much about, but it's part of this system in terms of the toxin. Angiotensin 2 causes pathological remodeling and progression of heart disease, vascular disease, renal disease. It causes vasoconstriction, increasing afterload to the ventricles, and increases thirst. So enough said about that, but chronically activated, the RAAS system is harmful. What causes aldosterone excess in heart failure state? RAAS activation occurs with the heart failure state, and it's aggravated by many of the therapies of heart failure. And one of the ones that we've been interested in is looking at pimobendan, which does not activate the RAAS. Furosemide clearly does, and we'll use that as a model for activation and for study. This chronic activation then produces inflammation, fibrosis, and hypertrophy within the vasculature myocardium. It produces electrical remodeling, which predisposes to arrhythmia. Radical oxygen species, it's very complex. It's not entirely understood, obviously, but this causes reduced vascular and ventricular compliance. This increases afterload and produces diastolic dysfunction. Systolic dysfunction accompanies this due to necrosis of myocytes, apoptosis, and fibrosis, and then aldosterone causes salt and water retention, producing signs of congestive heart failure. The electrical remodeling and potassium wasting that occurs causes arrhythmias and predisposes to sudden death. So that's a brief overview of the troubling things that occur with aldosterone.